For this lab, we took 7 skinfold measurements all done on the right side of the body. Be sure to be able to mark all 7 skinfold sites beforehand. First was the chest, which was a diagonal fold 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and nipple for women. Next was the tricep, which was a vertical fold on the posterior midline of the upper arm with the arm held freely to the side of the body. Third was the subscapular, which was a diagonal fold at 45-degree angle 1 to 2 centimeters below the inferior angle of the scapula. To find this, have the person put their arm behind their back with their thumb facing up. Fourth was the mid-auxiliary, which was a vertical fold on the mid-auxiliary line at the level of the xiphoid process of the sternum. Fifth was the superiliac, which is a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. Sixth was the abdominal, which is a vertical fold 2 centimeters to the right of the umbilicus. Seventh was the thigh, which was a vertical fold on the anterior midline of the thigh. When taking skinfold measurements, firmly grasp the skinfold between the thumb and index finger with your left hand 1 centimeter above the site to be measured. Keep the fold elevated while taking measurement and keep pinching the fold throughout the entire measurement. You will be holding the caliper in your right hand with the dial facing up. Next, place the jaws of the caliper perpendicular to the fold 1 centimeter below the fingers and release all pressure on the scissor grip. You are going to record the skinfold measurement to the nearest 0.5 millimeter. Wait 1 to 2 seconds after releasing the scissor grip. 2 measurements should be taken for each site. Therefore, in the presence of time, it would be best to start with the upper body measurements and work your way down in order to allow skin to regain its normal thickness. Measurements should be within 1 to 2 millimeters of each other. If not, retest the site for a third trial, then calculate the average for each skinfold site using the client's measurements and validated skinfold equations. Percentage body fat can then be estimated. There is one universal body density equation for men and one for women. There are 2 different body fat equations, which are the Brozek and the Siri equations. The table above shows the calculated body fat percentage for each of our subjects. Subject 4, the only male subject, was classified as ideal with the body fat percentage around 13.6. Subjects 1, 2, 3, and 5, which were females, were classified as average or above average.